Hi, this is Dr. Kwun calling from the surgery. Is this Mr. James Wilson?
Yes,
Can I confirm your date of birth to make sure I've got the right record, please?
yes, it's 12th of March, 1957.
Thank you. It's a good time to speak with you, Mr. Wilson.
Yeah, I live alone. Did you get my questionnaire thingy?
Yes, so we'll go through the questionnaire. Thank you for filling it in. Before we do that, could I ask you a few questions to put things in context, please?
Sure.
So I appreciate you've been having a problem with your mood. Tell me, how did this start?
Well, it started when I came back from Afghanistan that I was worried I might be having a relapse now from that time. But back then, I was all stressed out, seeing all my friends die around me, and I was given counseling. But the man was a total idiot. He was rude, no flimmin' use at all. And I was speaking to my friend Howie the other day, and he does shift work, so I don't see him often enough. And he's also got a new girlfriend, Caroline. So, but he suggested, that I seek, self-help. And he'd heard about this plant called St. John's wort. That might help me. And I'm not keen on medication if I don't know what it does. So I thought I'd ask you about it because I'm feeling, you know, can't relax, can't cope. I'm not sleeping well. In fact, I'm tossing and turning half the time and waking up in the middle of the night. I might wake up for a pee and then can't fall asleep again. I mean, don't know why the hell they call this the golden years. The only thing that's golden is the pee.
Well, thank you for getting in touch, and I appreciate it. It's been really difficult, and there's definitely things that we can do to help you and tell you about what treatment would be available. So, sounds like you've been struggling with your mental health and you're feeling low, you're not sleeping. Um, how would you say your mood is compared to last time? Because I could see you had depression several years ago. How is this compared to now?
Well, it's on a scale of 2 to 3, depending if it's a good day or a bad day. But seems that I start off all right, and then it's like a battery that runs down quickly, and I just go, and I don't feel like doing anything. I try watch TV, some of them are all right, some programs are all right, but some of them are reruns and just plain boring. So then I might try and eat, but I don't know. I don't seem to know what I want to eat.
So, have you lost interest in other things that you used to be doing?
Yeah, well, I mean, I used to think with my family, but we're estranged now. Lost contact. They've got their own problems, and they don't want to hear anything about mine. So we're ignoring each other.
And have you been feeling more tired than usual?
Yeah, tired and just lack of interest in general.
And sometimes people feel like they can't concentrate. Any issues with concentration?
I guess so because feeling lack of interest, I don't seem to be able to focus on anything.
Sometimes when people feel low, they hear some voices that other people can't hear. Have you noticed anything like that?
No, nothing like that.
There are various causes of low mood. May I check whether you've been feeling more sensitive to cold?
No,
Have you had any flashbacks,
no, nothing like that.
any vivid dreams at all?
No, hardly dream at all.
It looks to me that you're struggling a lot with your sleep. Your mood is quite low, and have you noticed any triggers to this time when you're having this low mood?
I don't know. Maybe it's just that Howie's got a girlfriend now, and I don't have anybody.
Hmm.
I don't go to him. I don't want to ruin his relationship, but he's always been a good friend, and I'm trying to be a good friend back. Trying to be happy for him.
Well, it can be difficult, especially if you had your friend and now you're not able to speak with your friend as much. In terms of the way that you've been coping? Sometimes people turn to alcohol. Have you been drinking more?
Well, I've been having a couple of lagers a night, and in the evening, watch the news and down one maybe then, and try and find a program that's interesting. And but I just can't seem to engage with anything that is on.
I see. Have you found that you're drinking in the morning as well?
No, it's just in the evenings to try and fall asleep.
And I can see you smoke 5 cigarettes a day on your record. Has it changed?
It's more or less stable, I think.
Mm. Any recreational drugs?
No, that's why I want to go for the St. John's wort. What your opinion on that? Something holistic.
I see. Sometimes when people feel low, they feel like life is not worth living. Have you had any thoughts of ending your life at all?
Ending my life, no, that would be against God's law. But as regards not worth living, yeah, I feel like I'm worthless. I feel like I've been discarded when I came, since I came back.
Mm.
Nobody wants me. Okay, you're an old fart. Just go away.
Sounds very difficult. Any thoughts of harming yourself at all?
No, I haven't.
Any thoughts of harming others?
No, don't want to do that. There's enough of that in Afghanistan.
Well, it sounds like it's been very difficult, and I understand that you are hoping for some help, self-help, and your friend did mention about St. John's Wort. I agree with you. The symptoms that you're experiencing um, is in keeping with depression, and I've had a look at the health questionnaire you fill. It looks as if the depression is moderately severe, which is something worth treating. Do you know much about depression?
Just from what I experienced the last time around.
Mm,
Not a
yeah.
nice place to be.
It is something many people do suffer with, and it's a right thing that you got in touch with us to seek help. Now, St. John's wort is some herbal remedy that some people might use. However, it's not something we would recommend. I understand that you're not too keen on medication. The thing is with St. John's wort, there's no robust evidence to suggest that it works. And also, the strength that you might get from it is something that we don't know. So that's why I can't recommend that. However, there are antidepressants that are effective for depression. If that's something that you're open to, I can discuss about this with you.
If you say so, then we can always try it.
Have you found the insights in this video useful so far? If so, you might be interested in SCA Blueprint. Just click the link down the description below and sign up, and you will get a teaching from me every day for the next 7 days. Antidepressant I'm thinking is sertraline. Is 50 milligram you can take once a day. And it might not work straight away, but I would suggest we give it a go for 4 weeks and see whether it helps to boost your mood. Would you be willing to try this?
Yeah.
As any medication, there's side effects. It can cause some upset of the stomach in the beginning. You might have a bit of dryness in the mouth. However, most patients tolerate it very well. And this is not a medication that's likely to cause any addiction, all right?
All right.
Some people might get some thoughts of ending their life when they start taking this. If you do have any thoughts like that, please get in touch with us. If you do feel like it's not working well, then I'd suggest you get in touch with us again instead of stopping it suddenly because it can cause withdrawal effects. Okay? I understand that you're drinking alcohol to help you to relax. The alcohol can cause your mood to be dull and affect your quality of sleep. We would recommend, if possible, to cut down. What are your thoughts about cutting down?
Well, if that's what's causing me to not be able to sleep, then yeah, I think so. But I thought it would help me sleep.
So alcohol might cause you to have a very groggy sleep when you wake up in the morning. You know, it might not be a good sleep. So if you try and cut down that might help in the long term with your sleep and your mood.
Alrighty.
Do you think you need any help with the alcohol, or you okay?
If you suggest that I speak to somebody, then I'd be nice to speak to somebody just anyway, because I don't see anybody nowadays.
Yeah, I think you would benefit from having a therapist who you could speak to. I understand you had a bad experience previously, but we have got a mental health counselor in the practice. If that's something you'd be open to, I could put you in touch.
Yeah, well, as long as the bed's up, it's better than the last one, then sure. Just as long as
Okay.
it's not the same guy.
Yeah, so we've got a lady who comes once a week. So if you'd like, I can ask her to give you a ring at some point this week.
Okay.
Have you got any questions on what we've covered so far?
So if I have questions, I'll ask that lady friend of yours that.
Okay. Well, if you do have any problem with your mood, you're feeling very down, and you want to speak with somebody, you can give us a ring back on the surgery phone line. If it's out of hours, then you can call 111. You know, if sometimes when you feel like you have any thoughts of harming yourself or ending your life, I could give you the crisis number just in case. Would that help you?
Yeah, why not?
Okay, great. So it was nice to speak with you, Mr. Wilson. I will write a script for you, and then you can collect that. And I suggest we arrange a follow up in 2 weeks' time to see how you're getting on. I'll give you a call then. Are you struggling with your consultation skills? Maybe you need help and you want to get constructive feedback. If you'd like to get help, then click the link down the description below to see whether I can help you. If I can help you, then we can enroll you on the one-to-one coaching program. Take care, everybody. Bye bye.